Broadcasting from the business capital of the world, this is the Podcast Business News Network. Yes, welcome back, everybody. Going to learn a lot today about something that is part of all of our lives. It is what it is, insurance, specifically health insurance. Big chunk of change if you are not getting it completely from your insurance, your employer, or actually your state as well. What's the best choice? But let's demystify all of this. And interestingly, the way we're going to approach this is joining us once again, somebody that owns a wonderful mental health practice in Idaho, and they deal with insurance all the time. So I'm going to kind of peel back the curtain there and give you some insight on that. Carey Krill is the woman that joins us. Your agency, again, what's it called?
Integrity Mental Health.
Thank you.
Yes.
And welcome back, by the way. Good to have you here.
Thank you. Nice to be here again.
And we are in good company. Who are we joined by?
Lindsay Clark Youngsworth, who owns Keenly Benefits in Idaho, Boise, Idaho.
Got it. So Keenly Benefits, what do you take care of there, Lindsay?
Thank you for asking, Steve. I help employers here in the Treasure Valley and all over Idaho. Actually, it's also employers outside of Idaho navigate our healthcare payment system. So in our country, we kind of associate health insurance as care, but it's really not healthcare. It is the payment model for the services that Carey provides, for example.
Correct.
And then we also have an arm of our business that helps with individuals and Medicare recipients to navigate the marketplace, for example, and Medicare, which are also unnecessarily complex and hard to understand.
That being said, I honestly, and this is rare, I don't even know where to begin with this. I'm not even kidding. There's so much.
Yeah. So for an example, every year as a practice, we evaluate all the insurances we take, and we look at how well are they paying us? How hard do we have to fight for the money? Are they covering all the codes? So I think this year we're dropping 5 insurance policies, all Medicare policies that either pay poorly, refuse to pay for add-on codes, or we have to fight for every dollar we get. So that's where someone like Lindsay and her company comes in, where I'm going to refer all those people that are on those plans and say, hey, the marketplace is opening up here soon for Medicare. Please talk to these people and they can help you find a Medicare plan that we will now take in the future. Or I'm happy to refer you to a provider that takes your plan currently. I don't really care which one you do. So I think those are the kind of things that people don't understand, is that every year practices have to reevaluate the bottom line and where they're getting paid. So it's best for you to know, as a person coming in my practice, why do I accept those insurances? And then Lindsay can help you figure out how to choose those correct insurances.
Wow. Yeah. There's so many different criteria for insurances, understanding it. I guess the bottom line is the basics, a deductible, what you're responsible for, the yearly. I can't even think of what the name of it is, because I want to shut it off my mind. It's just so frustrating. There's so much to know. Yeah. Maybe some of the basics. Lindsay, could you boil it down to things that we should know as we're picking our insurance?
I'm excited to be on this conversation. It's a little unexpected. It's really challenging. I think understanding your provider, just to give you some background with what Carey's an independent provider. So they're typically don't get to negotiate their contracts or even what they are reimbursed by insurance providers. That is a Medicare individual or a group policy. And so that's why she has to continually every year assess where she is as far as what's getting paid to her. They usually, speaking generally, get a much marketably lower rate than you would anticipate that they get paid as far as a reimbursement rate. What you need to know as a consumer is how that works a little bit, because you're always going to run into a situation that you might have chosen a policy in the marketplace that your provider was in that network and mid-year changed networks. So what do you do then? And especially in mental health, where, oh boy, you do not want to start with a brand new provider just because your insurance is no longer accepted by that provider. First of all, you can always talk to your provider about a negotiated cash rate. It will not apply to your out-of-pocket risk that you have, unless you're in the state of, well, not if your provider's in the state of Texas and you negotiate a lower rate than the insurance company, then they will apply that, but that's only in Texas. But it will not apply to your out-of-pocket. It would be something that you would need to pay on your own. But typically, it will be a pretty low cost versus what they're trying to bill to get $25. And quite literally, Carey's nodding her head. It's like, in some cases, $25 or $50 for the amount of time and staff. It doesn't even, sometimes with some clients, she's in the hole with what she gets from some insurance providers.
Absolutely.
Wow. And thank you for sharing all of this, because many times on the other side, we as the patient will look at all of it and get frustrated. What do you mean you're not taking it? Or what do you mean you're not paying? And I think there's also an understanding of what the deductibles are and, the out-of-pocket yearly cost on
out-of-pocket max versus deductible, right?
Exactly.
And people often don't understand that concept at all.
Yeah.
So, your deductible is the base amount you have to meet before your insurance usually starts picking up any cost. Occasionally, there's some other things where maybe it's a co-insurance, they'll pick up a little bit, but typically you have to meet your deductible before they pick up any cost. Then you have your out-of-pocket max, which is the amount you have to spend all year before your insurance then picks up 100%. So, and Lindsay can tell you a little bit more about that too.
Please do.
I mean, and it really depends on the type of policy that you purchase. So I'm going to take this out of, because typically you're working with these employers and having different types of strategic conversations into the end user, because you're right. It is incredibly impossible to try to navigate how this works. So there's copays, which is a small amount of money that you pay. It could be $30, $50. And on a lot of these smaller individual policies, they are high copays. And you have 3 metallic level plans. And in some states, they still have platinum level plans. In some states, they don't. But generally speaking, it's gold, silver, bronze. Bronze is going to be a higher deductible out-of-pocket risk and fewer upfront benefits. Gold is going to cost more and you get more upfront. If you're in the individual marketplace, and you have certain income levels, you might qualify for what's called a cost share reduction on the silver level, which lowers your cost quite a bit. And that's something you want to be aware of. Medicare, that's a whole other session. It's a whole other call. So we'll just deal with most of what consumers are having. And this is the same across the board. An HSA qualified plan, a high deductible health plan in which you could purchase an HSA, is exactly the way Carey said it. All of your medical expenses outside of your annual wellness and some wellness prescription drugs, which are designed and protected by the Affordable Care Act, you do not pay anything for. And those prescriptions would be typically your generic type 2 diabetes, heart medicines, like for high blood pressure and cholesterol, and some antidepressants and anti-anxiety medications, among others. And that's just a real Reader's Digest version of that. But you do pay 100% of everything outside of your annual wellness physicals for any doctor's visits. And all of that applies to your deductible. What they did with the Affordable Care Act is, prior to that, you had a deductible and you had an out-of-pocket, and they were separate. So they created that so it's one bucket. And every year, Health and Human Services determines what the maximum out-of-pocket will be on metallic plans. And that's fully insured small group plans, and then also the individual marketplace. And so on that number, that out-of-pocket expands and contracts every year. Right now, for a family, you're looking at close to $20,000 if 2 people hit their maximum out-of-pocket. On a bronze plan, a lot of the silver plans in Idaho, even some of the gold plans, have that maximum out-of-pocket risk, which is not over $9,400 for an individual. Just a side note there, we have 100 million people in our country that are insured that are in medical debt right now. And a lot of that has to do with these high out-of-pocket risks. Most people do not have money more than $2,000 saved to pay for medical claims.
Wow.
And it's a fundamental problem. And if you want to get into that, I'm happy to have another conversation about how to help people navigate that debt side. So every copay you pay, depending on what level plan you have, applies to that out of pocket. The deductible typically comes into play if you need lab work, if you need an x-ray, if you go into the hospital for any reason. So you walk into the emergency room, you understand, or a $9,000 deductible plan. And then the insurance company will pick up after you've met they'll come in and play with you at the coinsurance level until you've met your maximum out of pocket.
Wow. When it comes to that, the maximum out of pocket and all of that, how is it determined where the deductibles are used and not? Example, personal experience, physical therapy. Had a little arm problem. Went for physical therapy. They explained to me that it's an $80 copay. I'm sorry, it wasn't covered by insurance. It was $80. You're going to pay the fee. I did for one visit, then it got better and it was okay. However, I later learned that was the copay. The person at the front desk didn't explain it properly. But apparently it's not covered by insurance. It goes into the
out of pocket
funnel. So How is it determined what goes there and what doesn't?
That is all determined by, number one, part of it has to do with the insurance company themselves as they design those policies.
Okay.
And part of it has to do with what's called the actuarial value tables that are managed by Health and Human Services in our country. And so the actuarial value tables create this loss ratio for insurance companies. And so and the bronze, silver, gold, there's only so many upfront benefits that you can have for each. And it increases by tier, but if you choose a bronze plan, you're going to have fewer upfront benefits. So it's essentially a 60, 70, 80%. And if you have a platinum plan, 90%. So what that means is you would be responsible for about the first 40% of expenses initially until the plan picks up. And I don't know what tier you have or the philosophies of your insurance company. So the insurance company may or may not value offering physical therapy at a low cost. It really comes down to that as well. And then how they're going to work all of that in.
Wow.
And then there's all of the other parts of healthcare that come into play, but that's also another podcast.
Yeah, it's neat. And I have to remember whether it's silver, bronze. I honestly don't remember. All I know is I pay for it myself. So nobody subsidizes that. Carey, what do you want people to know coming from the practitioner side regarding insurance? We did establish here already and once before that a lot of times you don't make a lot coming from the insurance companies. What else should we know?
Yeah, I think for us, it's, I think the deductible piece is something that people need to understand. Those high deductible plans are very painful for patients early in the year until they meet their deductibles. So oftentimes what we'll see is people come in and they, it's let's say we charge $450 and your insurance says, hey, you have to pay $180 of that. It's really not me saying you have to pay $180 of that. It's truly your insurance company that you chose saying you have to pay $180. The number one issue we get into is patients get upset with us about it. And then I'm like, yeah, I didn't choose that plan. It's a crappy plan. I agree, especially because you need to come see me every 2 weeks for a shot. And now it's $180 until you reach $7,000. And for someone like that, I would have never chosen that plan. I would have chosen actually a low deductible plan with copays, which is going to cost them more out of pocket monthly, but in the long run, it's going to cost them significantly less because of how often they have to be seen. And so it's those pieces and parts of like understanding how often do you see a doctor? Are your doctors your network? Do you have very expensive meds? Those are the things that you can actually plug into, at least in our state. You can plug into the online website and it will tell you, this plan is going to work the best for you. It's going to cost you the least overall. Or go to somebody like Lindsay, has a person in her office that will meet with you one-on-one and go through those things. And I actually would strongly recommend that if you're in the marketplace, going to somebody in your state that actually understands the marketplace and meeting with them and going through those specifics. Because, if you don't do those things, it's actually a really challenging system to understand.
Yes.
And you might end up owing a lot more than you think you're going to owe.
Yeah. Yeah. What I'm getting here is, depending on your situation, but by and large, we look at insurance as something that's provided to us. Yes, we have to pay. It's coming from the state. Sometimes they pick up depending on as part of it, depending on your salary. Right. But the big picture here is you're paying for a service. You need to get the best possible service for your needs. I don't think we look at it that way quite often.
Yeah. Yeah. Healthcare is a service. I mean, that's what we are here to do. We are here to help and serve you. And insurance is a service also. It's just,
Sure.
It is. And I think to Carey's point, yes, you definitely want to work with somebody that can help you. And in every state, in every marketplace, Idaho actually, in the first year of the open enrollment, had the highest engagement in healthcare.gov. We have our own exchange now than any other state. And that's because Idaho continued to add value for brokers to help people. And then it became a thing all across the entire country where you can access a consultant to help you navigate your individual marketplace. And you do want that because if you work with somebody, like, for example, in our office, it'd be, okay, you can't afford this other richer benefit plan for, everybody's situation's different, plug in whatever you think. Have you talked to your provider about what they will do as far as a cash pay model? Could we add that in for you? Because we're seeing more and more employers going direct to providers and creating relationships and contracts with providers directly. So then providers can continue to treat patients without having to worry about billing and don't have to worry about prior authorizations, and they can just do their job. Because that's the other barrier for Carey is you do have an insurance provider that will question everything that she does. Is this really medically necessary for this patient? And it can be soul-sucking at times, I'm sure.
Yes. Because it's so much money. It's so much money going out the door. Yeah.
It's a lot of money. I mean, I think the other piece that I think people don't understand is the number of people that a practice has to actually employ just to deal with insurance. Mm-hmm. So, you come see me as a provider. It looks like it shouldn't be that expensive to run a practice because you don't see all the back end people that are employed that are just managing your insurance benefits, prior auths, making sure you're eligible, making sure that your meds are covered and doing the prior auths, billing. There's so many pieces and parts that people do not see that it makes a practice extremely expensive to run. So, yeah.
Wow.
And then we lose the independence, which is super critical in our healthcare system, is having independent providers, working together, but without being able to create outside of a groupthink environment. It's just, there is some beauty to having something local that from your, other activities that you can access.
Yeah. And I would agree with that. I mean, I've worked both in large group settings for hospital systems. And I now, I've worked independently for myself now for 6 years. And there's a very different mentality, and there's a lot of different mentality in working for a large group system. There's a lot of things you cannot do in a large group system as far as patient services and offering a lot more one-on-one time that I cannot do when I work for a group service.
Gotcha. I want to reflect back for just a moment to Lindsay, what you said before about retaining, hiring, or getting a consultant to help you figure insurance out, especially with the marketplace. Are those people who are these people?
They're people like me. I mean, I did that for quite a few years until I realized I couldn't make any real change in our healthcare system, helping individuals as much as they need that help. So my sister has stepped in to take on that role. They are paid. There is a commission that is built into the premiums of your plan. And in my state, in Idaho, and I believe it's probably the same in every state, but that is the fee. And whether or not you work with a broker or a consultant, you're going to pay it to the insurance company. And I'm going to tell you, it's not a lot of money. In our state, it's roughly $15
Wow.
per member per month, and that caps at 4. So if a family of 4, I mean, nobody's getting wealthy here helping you, on your one policy. We're not tied to premium. We are really wanting to help people avoid the situations that Carey is talking about, where you're not getting the care that you need, so that you can live a good life.
To share, knowing how to deal with the marketplace here in New York, I looked online for what sounds like what you're describing. But every time I found somebody, when they knew I was in New York, they said, "Oh, no, we can't handle it. Nope, we can't handle it." And why would that be?
Every state, it depends on if you want to find somebody in your state. Every state has their own rules, and every state has different plans. So it's, unless you are super, so hard to keep up with everything here in Idaho. And there is a possibility that people know all kinds of aspects of different plans, and there's ways to aggregate information. But to really get granular and say, oh, you don't want this carrier because for this reason and this reason and this reason, you do need somebody who has had real tangible experience with other clients that maybe you placed with a carrier that's really difficult to work with.
Gotcha. Yeah. Stands to reason, if you have assets, you have a financial advisor, why not have this? It's definitely pricey. Closing thoughts here, Carey, anything you want to share from your side?
From my side, I would just say, that there are resources out there, like Lindsay, and I would definitely take advantage of those resources.
For sure. And our association, the National Association of Benefits and Insurance Professionals, or NABIP, you can actually search on their website for brokers or consultants near you, and you can search by what they offer too. They usually have it designated like, I help Medicare and individuals, and then you can give them a call, and you can do it even by your zip code to some degree. The association is very committed to making sure Americans have access to help. We know how hard it is to navigate. And I do want to throw in one thing, because I did mention that a lot of people do have medical debt. And before we wrap up, there is a part of the Affordable Care Act that if you went to a nonprofit hospital, in our town, there's 2 big hospitals, and they both are. In order to keep their tax exempt status, they are subject to what's called Section 501R in the tax code. And what Section 501R is they're required to work with patients on their patient responsibility, regardless of insurance. So if you have insurance or not, and they work like the marketplace. So at 400% above the federal poverty level, spit it out, and below, they'll write off a portion or all of what you owe. And they are not supposed to make this difficult for you. And they do notify you, but it's in very small print. So it is one of those things that a lot of people in this country do not know. And as soon as I can get that word out, I'm happy to just Section 501R. If you have medical debt, or if you haven't had a big claim, regardless of what you owe, ask for that Section 501R assistance, and they have to work with you, or they start paying taxes.
Wow.
Yeah.
So. What an eye-opener.
I would also throw in, as a small practice, just call out, and if you have debt with us, just reach out to us.
Mm-hmm, mm-hmm.
I don't want to send debt to collections. It costs me money. I would much rather you pay me $10 a month, $20 a month, whatever you can afford. Let's pay it off. And most practices are this way. They do not want to send things to collections. Sure. They will work with you.
You do want to work with your independent provider always. That is why it's so important that we keep independent practices, because you do have a lot more flexibility. They are willing to work with you. There are solutions they can offer. If you can't get a prescription, if there's a prescription you need, you can't afford, there's also assistance through manufacturers. There's ways around this. But to Carey's point, yes, call your provider. They don't want you suffering.
Thank you for all of us today. And I love how, yes, we're talking Idaho, but it applies to anywhere in the country. And you both genuinely want to help people. And it shows. Absolutely. Yeah. Carey, how do we connect with you, learn about your agency in Idaho?
mentalhealthidaho.com.
Gotcha. And Lindsay?
KeenlyBenefits.com. Keenly, Keenly, benefits.
Beautiful. Learned so much today. Really did. Can't wait to go online and do a little bit of research. Appreciate it very much. And thank you both for being here.
Thank you, Steve. Have a wonderful afternoon.
You too. We'll be right back.
Bye.
Broadcasting from the business capital of the world, this is the Podcast Business News Network.
When it comes to making plans, you are the best. What about those round trips that you plan in advance, which are perfect on your way there and perfect on your way back? Or those meetings with friends for which you make a group chat 3 months before so that nobody or anything is missing? Or your daughter's first birthday party. You planned it with such dedication that instead of the first, it felt like our 15s. The same way you plan each detail for those moments. Start planning to protect you and your loved ones from a natural disaster. Sign up for local weather and emergency alerts. Prepare an emergency kit. And make a family communications plan. Protecting your family is the best plan you can make. Get started at ready.gov/plan.
Brought to you by FEMA and the Ad Council.